Welcome back. Thank you very much for staying with us. This is Your World, and today is a special edition of the show where we are focusing on understanding cancer treatment, because again we have mentioned a number of things that have been an impediment as far as cancer treatment, that is access to cancer treatment, is concerned. So right about now the question that we're asking you is all about, have you ever considered going for cancer screening? Once again, have you ever considered going for cancer screening? If so, tell us your experience. If not, again, tell us why you have not gone for screening. But for now, again, that is the question of the day on your screen. Have you ever gone for cancer screening, and would you go for one? That is the question that we're asking you today. So at NTV Kenya, at Lubembe_Winnie is how you can reach us, and as well feel free to call in. So Lois Angui is in our Eldoret studios ready for the discussion. So Lois, take it away.
Many thanks, Winnie. And first, let me introduce my guests this morning to help us understand better cancer treatment. Seated next to me is Dr. Sarah Obuya, a clinical oncologist. Many thanks, Dr. for joining us. We also have Esther Andare. She is a cancer survivor. Esther, thank you for being here. And we also have Rose Wekesa. She is a radiation therapist. Dr. we start with you, and we go right into understanding cancer treatment. Earlier we were having a conversation, and you noted the first point, or where oncologists begin when it comes to cancer treatment, is on the issue of acceptance. Please talk to us about how important it is for a cancer patient to accept their situation, even as they await doctors' advice on their mode of treatment moving forward.
Yes, good morning, viewers. The most important thing usually is to listen to your body, because most of the time you listen to your body, you will pick up clues that there's a problem that will take you to the hospital. But do not wait for that, because there are structured screenings and there are campaigned screenings. Every so often we go outside into the field and screen people, and it is amazing how many people we have picked from field screenings. Having said that, when a diagnosis of cancer is done on you, just like any other illness, it's of utmost importance that you get to understand what is going on with you. Why should you understand what's going on with you? So that you are able to accept the journey, because cancer diagnosis, management, and follow-up is quite a journey. We stay with our patients for a very long time. In fact, most of the times they become our very close friends. We develop feelings of being there for one another. And this important step of accepting the diagnosis is so crucial that it will make the difference between you surviving the illness or succumbing sooner than you ought not to have succumbed.
Okay. All right. So, Esther, the year is 2015, and you're diagnosed with ovarian cancer. Tell us how your journey began. Was it a voluntary walk-in, or did you have symptoms that prompted you to go to hospital?
Well, mine started much earlier. Of course, with the symptoms that were there, I was not able to catch up on it. But when it started, I was pregnant with my second-born child, and for some time I was diagnosed with quite a number of things, in which sometimes were diagnosed as persistent UTIs, missed abortions, bleeding throughout sometimes the pregnancy, and for some time, you know, it looked like the normal kind of symptoms any pregnant woman would maybe have. But after that, after giving birth, now the abdominal pains persisted. The bleeding persisted. Sometimes these abdominal pains would be really, really bad, affecting even the back, sometimes even my ability to walk properly, to do my work, my normal routine. So one day, as I'm just relaxing, I have a sharp pain on my left, and it was quite a persistent pain that was not letting up. That pain that continues on and on. The more you sit, the more it continues being worse. So that was the first time now I had to rush to hospital. So from that diagnosis, the first doctor I saw said it could be appendicitis or maybe an ovarian cyst that is twisted. So in my head, quite frankly, I thought it was just that. I never expected. My family had no history of cancer. So and from even the people I've interacted with, people never quite believe that you can get it. It always seems like it's the other person.
Until it is
until it is you. So after that, when I was rushed to the hospital, now for the removal of the cyst, that's when they realized, that it was cancerous.
All right. So that day you went home after the removal of the cyst, and I want to believe our doctors now took that particular...
They went ahead and performed the full hysterectomy, yes. And then now after that, now they followed it up with a treatment. There was no time for me to think about it. But now after I came to, when they told me, now the hardest part...
So, what duration is this from the moment you...
You see, now when it was a cyst, because it was very painful, the way to go about it is to remove it, remove the affected ovary.
Then you went home?
Yes. Before I went home, they sent the sample to the lab for histology. So I went home, and afterwards, after 2 weeks, they called me back and they tell me the results.
All right.
Yes.
So were you alone? And if you could paint a picture for us of that particular day, your third doctor is telling you now, here, Esther, I think there's this problem. How did you take it?
It was a shock. Honestly, I disappeared for 2 weeks. I didn't go back to the hospital. I stayed away from friends. I didn't tell my parents. And then, you know, also this is something that for some time, when people talked about it, it belonged to a certain caste.
Social class.
So you start asking yourself questions on why you, why at that age. I was as still quite young, and of course now you look at the people who have been through it. You start getting afraid because because my greatest fear actually about the treatment was losing my hair, but I didn't look at the other factors until I started a treatment.
Okay, thank you, sir. And we'll come to your experience of the treatment. Daktari, the options that we majorly see being advised to cancer patients is chemotherapy, radiotherapy, and surgery. I want us to start with radiotherapy. How and when does a cancer patient get advised to do radiotherapy, and how do they go about it?
Thank you so much. So I would like viewers to understand that radiotherapy is actually a local treatment, and it is also a palliative treatment. Palliative means that a patient could present with like obstruction from cancer, so they cannot breathe well, so we can take them for an emergency radiotherapy. Or they are bleeding so much from their cancer, so then we take them for emergency radiotherapy. Having said that, radiotherapy is basically a local treatment. It means that your cancer has been staged. There's something called cancer staging. When we make a diagnosis of cancer in a patient, then there are several tests that we run. We put this together according to a scientific criteria, and then we say this cancer is stage 1, 2, 3, 4, or it is metastatic disease. And you are sent for radiotherapy when your cancer is fitting in one radiation field, which means at most, for most cancers generally, we hardly radiate beyond stage 4.
Stage 4?
Yes.
Okay.
Yes.
So if you're in stage 1, 2, 3, you qualify for radiotherapy?
It depends on which cancer that you have, because not all cancers are radio responsive. There are certain cancers that are very radio resistant, and there are others that are radio sensitive. So for the radio sensitive cancers, we stage you, and then if you fit in one radiation field, then we do something called workup. And then when we find you fit, we can now send you to the machine. It's a whole science and technique, because it's not just a matter of sending you to the machine. We have to know exactly where your cancer is, because it is a precise science. It is precise in that when we put you under that machine, the cancer must get the full dose of therapy. While you are doing that, you must protect the organs that are surrounding the cancers. For example, if you're subjecting a patient for radiation for cancer of the cervix, you want the tumor, the growth itself, to receive maximum dose acceptable for that cancer. But at the same time, you want to protect the rectum, you want to protect the bladder, and you want to protect your head of femur. So it's a precise science with the dosages, just like, you know, when they give you antibiotics, they tell you, take this drug this so often for this number of days. So in radiation, we have doses that we call grays. So you can have 1.2, 1.8, you know, 2 grays per session. A session is that you go on the machine once each and every day, except on public holidays and weekends, for the total number of radiation doses that you have been
has advised.
as advised. And the doctor advises according to the type of your cancer. You know, it is not just enough to say that a patient has for example, cancer of the breast. Cancer of the breast is a whole syndrome. We need to test you and know, are you hormone receptor positive patient? Are you a HER2 positive patient? Are you a triple negative patient? And if you are, is your cancer just localized in your breast, or it has gone through the skin of the breast, or it has gone into your lungs, or it has gone into the surrounding lymph nodes. So it's a whole syndrome. It is actually such a fallacy just to say, you know, I have cancer of the breast. Yes, there is much more.
There's much more. And Rose, I want to imagine this is your daily life, radiotherapy. I'm sure you have amazing stories of cancer survivors and people who have gone through the treatment successfully, and also sadly, cancer patients who have lost the battle during radiotherapy. Talk to us about radiotherapy from where you sit. How do you appreciate its contribution when it comes to the treatment of cancer?
Okay. I think I will first start by echoing Dr. Sarah's words. She did mention that the intent of the radiotherapy may be to completely eradicate or for long-term control, and the other one is for palliation of symptoms. Rather than just looking at it for long-term control, I do appreciate radiotherapy whenever we come to palliative treatments. She did mention about obstruction, and if the patients are coming with an obstructive syndrome, for example, you give radiotherapy and you see that relief, patient is able to breathe again and they are back to normal. At least I do appreciate that is a fast relief of such conditions. And for long-term treatment, although it's most of the time it may not be by itself radiotherapy, it's combined with other modalities, for example, surgery or chemotherapy. But we've been able to see that the patients have survived quite a long time. And I think that makes me really happy about what I do on a daily basis. Yeah. And
for the patients who are coming in, let's say for the very first time, do they come to you with a lot of questions? Are they scared? I want to imagine, Dr. was saying you're put in the radiotherapy machine.
Yes.
What are the questions that they frequently ask you when these patients come? What are their greatest concerns when it comes to radiotherapy treatments?
Okay, definitely they do come with questions, yes. And the questions that come, you did start about asking about acceptance. Sometimes you realize that the patients are coming to you, they have been explained the procedure. and what it entails to go through such treatments, both chemo, radiation, and surgery. But still, when they come to you, they want to hear what you're telling them as a radiation therapist. So it is quite interesting that sometimes now you have to try. The doctor has taken them through, but they also want to hear from your side. Am I going to get exactly the same what the doctor is saying? Some of them will be optimistic that they are fine, or they will be okay at the end of the treatment, but others, you know, they've already, some may have given up, so the acceptance is not there at that particular point. So you have to try every day to keep talking to them, about the same, about the expectations, and then the side effect that is related to that. So sometimes when you mention the side effects to the patient, and they're wondering, am I going to go through this? But then it's something you have to tell them beforehand as they go through the treatment. But eventually what we have seen, trying to talk to them on a daily basis, at some point or like midway their treatment, you see that acceptance coming in. Yeah, and then they cope towards the end.
Okay.
Yeah.
So Esther, you're diagnosed with ovarian cancer, and the doctor has advised for surgery and chemotherapy, you had told me. So when you had these interventions being mentioned by the doctor, what came through your mind when doctor said now you require chemotherapy and surgery so that we are able to deal with your ovarian cancer?
The first time actually, now after they gave me the plan for the treatment, you remember now the first surgery they did remove the affected ovarian.
Yes.
So now you're being told you have to go back again, so that because there's always a possibility of other areas being affected with
the cancer spread.
Yes, and the cancer spreading. So they look for long-term solutions, and for me, surgery was one of the best solutions at that time. Okay. And then now followed by chemotherapy. So, like I've told you, as acceptance, and the doctors keep saying it, is easy and hard at the same time. Easy when they tell you, and when you go back home and you're seated now thinking about it, very difficult. Because it is not like we have no knowledge of the disease for some of us, and we have seen what it has done to other people. So you start comparing yourself with what you've seen, and the thing that goes through your head is death, because the ones you've seen before you have gone through the same journey, and that is now what creates the fear. And also, if you'll have the strength to go through it, yes. And
I want to imagine, were your fears more on the chemotherapy or on the surgical part?
I didn't know what it felt like going through chemotherapy, so I had no fear of it. I was more afraid of the effects,
the side effects.
Yes, that I kept seeing from other patients I'd seen on TV or heard about. So I had no idea what it felt like to go through.
Did you have a particular side effect that you had heard about and you are really, really scared about?
Yes, the loss of hair. I kept wondering how people would look at me, and the fragility of the body after chemotherapy and all. So that was actually my greatest fear before going through the treatment. And also telling my friends and my family members, including my husband, and the response thereafter. Yes.
And you'll take us through that later. Dr. Esther ushers us into the conversation about another mode of treatment and management for cancer, chemotherapy. Break it down for us. What does chemotherapy mean, Dr., and how do you apply it?
Chemotherapy basically means the use of cancer chemotherapeutics. You know, these are drugs that have been produced to fight against cancer cells, and we have several classes of drugs going all the way. There are almost 9 or so classes.
Okay.
So again, your
it's
doctor...
the use of drugs?
Yes.
Okay.
So your doctor will look at your cancer, and they will tell you that your cancer is responsive to chemotherapy. And once they tell you that, they will choose a combination of these cancer drugs that they will use to treat your cancer.
Yeah.
And that combination is actually quite scientific.
Okay.
You mix drug from class A and B and C, and then they work on something called the cell cycle. And basically what they do into the cell cycle is that they destroy, you know, the engines of the cancer cells that make them reproduce. They can destroy that engine, or they can stop the engine, or they can act as barriers towards the proliferation and multiplication of the cancer cells. Now, these chemotherapeutic agents, the ones that you call chemotherapy, they come in various forms. You can have them in tablets. You know, your doctor can tell you that you'll be swallowing this drug morning and evening or once a day for this number of duration. And then we will give you in this number of cycles. There are things we call cycles in cancer chemotherapy. You know, your drug could be every week, or it can be every 2 weeks, or it can be every 3 weeks, or it can be even be daily, depending on your cancer.
Okay.
But the most cancer chemotherapy the people understand is the one that is given through the veins. Probably because it's a process. Before we give you chemotherapy, we have to assess you according to laid down performance statuses, the famous one being ECOG performance status, because there's a status beyond which you do not qualify to be on chemotherapy, because then the chemotherapy will be more toxic to you than just leaving you alone. So once we assess you and find that you are fit to have chemotherapy, we have to check that, you know, your kidneys and your liver and your bone marrow is working well. Why is this important? You know, we need good blood levels, you know, like an HB of more than 10 for your drugs to work very well and for you to keep going. The kidneys and the livers are very important because that's where the chemotherapy drugs, once they do their work, they are degraded and excreted out of the body. Why is this process important? This is so important because you can get something called chemotherapy toxicity. What is toxicity? All drugs are toxic. That's the reason why there's a specific dose and duration. So we have to make sure that the systems that will degrade these drugs in your body and excrete them is perfect.
So, Daktari, that goes to say that before a patient goes through chemotherapy, doctors have to ascertain that their immunity level is at their best.
It really does not have to do with immunity, but immunity is very, very important because your white cell count have to be at a good level.
That's a good level.
The reason is the cancer drugs themselves will make your immunity go down.
Okay, Daktari, I want to cut you at that. We come back to you with more. Daktari, we have tackled surgery and radiotherapy, chemotherapy. When we come back, much more on that, cancer treatment plans and opportunities that are there to ensure that cancer patients understand cancer treatment. We take a short break on Your World, but we'll be back with much more from our Eldoret studios. And remember, give us your contributions and your thoughts. And this morning we are asking you, have you ever gone for cancer screening? If yes, tell us. If no, tell us why. So we go on a short break. We'll be right back.